I'm going to introduce the 3R's approach to back rehabilitation. And the 3R's approach is a clinical framework to guide practitioners and exercise professionals when they're putting together rehab programs for somebody who's suffered from low back pain. Now, why is this necessary? Well, often there's quite a lot of conflicting reports and advice on social media and in the press, and people often are confused as to what treatments they should use and what treatments the patient should receive. So typically, for example, people will say, well, you shouldn't do massage or manual treatment because it disempowers the patient, and yet patients will often say that they improve from those treatments and they enjoy having those treatments. Others will say, well, keep your back straight and bend your knees when you're lifting, and others will say, well, you need to bend the back because it builds resilience. So people are often rightly confused, and the aim of the 3R's approach is to provide a clinical framework to guide us through the treatment procedure. So 3R's stands for reactive, recovery and resilience, and these are the three phases that we go through when we're rehabbing a patient, and they are based on the natural healing timescale that the body goes through. So what do we mean by that? Well, if you cut your hand, you'll initially find that the skin is punctured, and so you start to bleed. And at that stage, the action that you would take would be to put a pad on your hand to stop the bleeding. Eventually, the blood starts to clot and forms a scab. And at that stage, you try to rest your hand. But if you rest too much, it starts to get a little bit stiffer. And in a few days' time, you say, well, I want to start moving things, and the scab gradually starts to flake off, and you'll end up with a red scar. That red scar gradually heals further and it becomes white, and as that happens you try to move your hand and get it going, start to strengthen the hand up again. So we could then say, well, is movement right or wrong for a cut finger, a cut hand? And the answer to that is it depends on the stage of healing. So movement when we cut our finger wasn't good. Gentle movement when we had a tiny scab was okay. More vigorous movement was what was required once the scar had healed. So we're matching the healing timescale with the technique that we're using. And that approach is often used with sports injuries, with soft tissue injuries. And the 3R's approach adapts this for rehabilitation. So we've got our reactive phase, our recovery phase and our resilience phase. And in the next video we'll have a look at how we start to put those together.